Our interdisciplinary group works with global models that estimate how quickly we should reduce our carbon dioxide emissions to avoid dangerous climate change. These are the same models used by the government to estimate the social cost of carbon. So the standard trade-off in these models is between the costs from future climate change on the one hand, and on the other, the costs of reducing emissions. These existing models provide some guidance for policymakers, but they ignore some key factors that should also be in the equation. So one key factor that existing models ignore is that when you reduce carbon emissions, you also, as a welcome side effect, improve public health. More specifically, when you stop burning fossil fuels, for example, by closing a coal power plant or by choosing to walk instead of drive, you not only reduce emissions of carbon dioxide, but you also reduce emissions of air pollution aerosols. And air pollution kills people. So one possibility, taking that into account, is that this positive side effect for public health might be the most important part of the equation. However, reducing air pollution aerosols also has a downside. So the problem is that reducing aerosols actually increases climate warming by reducing the amount of sunlight reflected back into space. So therefore, another possibility is that the public health benefits of reducing aerosols are actually outweighed by the increased warming from cleaning up the air. So to investigate what happens when all of these factors are properly accounted for, we add them to the existing models to see if they tip the scale in one direction or the other. So next are the results.
So this graph shows the optimal amount of carbon reductions that existing models tell us that we should try to achieve, taking account only the trade-off between carbon mitigation costs now and the costs of climate change in the future. It's therefore our reference case. The x-axis is time and the y-axis is the percentage reductions in emissions compared to a baseline without any mitigation. You see that we start with reductions of around 15%, and that increases until we achieve full decarbonization around the year 2135 globally. This red line shows how optimal mitigation changes when we add only the unfortunate warming effect that occurs from the aerosol co-reduction. Health impacts are not yet included. As you can see, the near-term warming pushes against early mitigation. On the other hand, this yellow line accounts for the health benefits from aerosol co-reductions, but ignores the warming effect that's included in that red line, and therefore suggests that we should mitigate more. So to summarize, the health-only line entails roughly twice the mitigation in the coming decades as the reference scenario, while the red line entails roughly half the mitigation. Therefore, these forces are large, they're in opposition to each other, and therefore accounting for only one of them in policy analyses would be misleading. What we need is an estimate of the optimal mitigation that includes both effects, now presented as the purple line. Carbon mitigation reduces aerosols, which causes near-term warming, but it also improves public health. As expected, this purple line is intermediate between the red and the yellow, but it shows that the health effect is dominant, as the graph shows that we should still reduce emissions by around 50% more in the coming years when compared to the blue reference line, which is what existing models tell us we should do. And in terms of the distribution of the health benefits over time, this graph shows that India in green and China in purple reap the lion's share of the benefits in the near term, while Africa in gray gain most in the later decades. So this provides a strong case for carbon mitigation, even in areas with lower per capita emissions and less responsibility for climate change.